Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. The study that I'm citing today was published in the journal Nutrients in 2017. Now, this very large study on an aging population in southern Germany, known as the Cora Age Study, showed of particular note that more than 1 in 2 persons over the age of 65 has suboptimal blood levels of vitamin D. Now, as well, researchers reported low blood levels of vitamin B12 in 27% of the subjects. So overall, the scientists examined blood samples of 1,079 older adults aged 65 to 93 years old. So their analysis focused on levels of 4 micronutrients: vitamin D, folic acid or folate, vitamin B12, and iron. So the Cora Cooperative Health Research Platform has been examining the health of thousands of people over about a 30-year period. So the results show that 52% of the examined older adults had vitamin D levels below 50 nanomoles per liter, and thus were categorized as having suboptimal vitamin D status. They also noted that 27% of the older subjects had vitamin B12 levels below the cutoff point, and 11% had iron levels that were too low, and almost 9% had low blood levels of folic acid as well. So these findings are really important and mirror similar reports seen in other developed countries. So regarding vitamin D, the ideal blood level associated with prevention of many cancers, as well as osteoporosis and diabetes, is a blood level at or above 75 nanomoles per liter. In the Cora study, more than 50% of the subjects had blood levels of vitamin D below 50 nanomoles per liter. That's cause for concern. Regarding vitamin B12, low blood levels can cause anemia in advanced stages, but at the earlier stages of B12 deficiency, in the marginal stages, it causes memory loss and dementia-related symptoms, as B12 is required to make neurotransmitters in the brain that are required for memory and cognition. And the same is true for folic acid. Severe deficiency causes anemia, but a mild deficiency in folic acid causes memory loss and cognitive impairment. As well, folic acid and B12 are both necessary to keep blood levels of homocysteine in check. Insufficient B12 and or folic acid result in high blood levels of a damaging agent called homocysteine. And homocysteine damages blood vessels and can promote the clogging of arteries. In fact, a report in the Journal of the American Medical Association a few years ago suggested that high homocysteine levels account for 10% of all heart disease deaths each year in the United States. And high homocysteine blood levels also promote dementia, Alzheimer's disease, and osteoporosis. By having adequate folic acid and B12, you keep those homocysteine levels down. And as for low iron, severe cases of low iron cause anemia, of course, but marginal deficiencies of iron, stage 1 iron deficiency, results in having less energy, memory loss, decreased concentration ability, as well as a decreased resistance to the development of infections. So it's very likely that these nutrient deficiencies begin to appear long before people are 65 years of age. That's why I encourage all of my adult patients to include the following blood tests on each annual physical exam. And it's because a lot of people are in the marginal deficient states of these. So vitamin D, blood levels now, vitamin D, vitamin B12, red blood cell folic acid or folate, serum ferritin, which is an indicator of iron status in most cases, and also blood levels of homocysteine. So unfortunately, many provincial and insurance plans across the world in North America, they don't pay for vitamin D blood tests or the homocysteine blood test, and thus many doctors don't order them or recommend them, but they're actually very important. So you should request these tests at your next annual physical exam. They're not that expensive, and they provide a tremendous insight, really, into your potential risk of future disease. So the good news is that you can improve these blood test results via improved dietary practices and through the use of supplements if your values are in the suboptimal or marginal deficiency range. So in my view, you should really ensure that every year you're tracking your blood level of vitamin D, vitamin B12, folate, ferritin, and also other related iron tests, and homocysteine. Ensuring optimal status of these nutrients can translate into many more years of enjoying a highly functioning body and mind and disease-free living, which is something that we all want. So I've included a link to the research in the text below. So thanks for watching, and I'll see you next time.